Here are the modifications you asked for how to get to the ground and work on your mobility when you can't get to the ground. So here are the things that I suggest. Okay, so you cannot get to the ground because what I was asking people to do was get down and then get back up. See how I've worked really hard to be able to sit on my heels, come up, bring my leg up, push up, down. See how I had to control that? This is your quads, and there is strength there. Then I also have mobility here. Step one, let me address, if you have a knee replacement or sometimes post-op surgical, a different type of knee surgery, you may not be able to kneel on your knees. And that is okay, and that does happen. Now, in that situation, I'm not going to force trying to kneel on your knees, but what we could do is use a chair to work on our quad strength and do a squat. Now, you're squatting when you go to sit down, but if we were to talk about exercise, we could do a mini squat. Now, I call this the Oompa Loompa, like an Oompa Loompa dancing, right? This is not a lot of bend in my knees. When you look from the side, not a lot, but could you put your booty on the chair, stand up? This would be my suggestion for where to begin. Sit down, stand up, like musical chairs. How many can you do? The cool thing is with exercise, as you do it more, you become stronger and you're able to do more as you go, but you have to practice it, and most people don't have a plan in place. So I'm asking you to find a chair and to do some squats. Now, if you are more mobile than that, you don't have a knee replacement, you just have pain, let's try this. Sometimes the reason you can't get to the ground is balance. So your glutes aren't able to stabilize you when you stand on one leg, so you wobble. So we're gonna hang on to a chair as we go down to the ground. And what it oftentimes looks like for my patients is their like kind of legs are all over the place and then they collapse down. That's okay. If you got to the ground and you're bending your knees, bravo. Now, another problem people have, so they can't get to the ground, so I say use a chair, is they can't kneel this far down to put their booty on their heels. So we use a pillow. Or take this pillow, and we are going to put it between our butt and our heels when we kneel down. So you're gonna use your chair to get to the ground. It might look wonky, it might look bad, that's okay. Knees on the ground, take the pillow, put it by your butt. It's on the back of your legs now, and then you sit down. Now we'll kind of come back up and sit down. And I feel like a 1980s workout instructor. And up and down. Okay, so you've done that. Next thing we could do is, can you use this to push down because your quads don't have enough force to push down? And can we push, come up, and do your best to get that leg forward? And then you might have to put your hand on your knee and your hand on the chair. You may need to bring your chair forward. I don't want you to tear your rotator cuff. And then I'm pushing down with these 2 points to help support this quad to get me off the ground. Now, if you haven't learned yet, your quads are very important. Your muscle mass matters, and this is one of those reasons why. Because I need you to have enough quad strength to get up from your chair, to go up the stairs, and to get up off the ground. And ladies, this is why I talk about muscle mass. In the functionality of it all, it helps you actually function. I need you to be able to get up and down so that you're not frail, that you're strong, you could do all the things you want to do. So, pushing up, back down. And you can do the same leg if you want. You can alternate if you want, but these are my modifications.